Hyperthyroidism is a medical condition characterized by an overactive thyroid gland producing excessive amounts of thyroid hormones, primarily thyroxine, T4, and triiodothyronine, T3. These hormones regulate the body's metabolism, and when their levels become elevated, many physiological systems accelerate, resulting in a wide range of symptoms and complications. Hyperthyroidism affects millions of people worldwide and, if left untreated, can lead to serious health problems. Anatomy and function of the thyroid gland. The thyroid gland is a butterfly-shaped organ located at the front of the neck, just below the Adam's apple. It plays a crucial role in metabolism by producing hormones T3 and T4, which influence how the body uses energy, controls temperature, and regulates growth and development. The gland's activity is regulated by thyroid-stimulating hormone, TSH, secreted by the pituitary gland in the brain. When the thyroid produces excessive hormones, it disrupts the delicate hormonal balance. Causes of hyperthyroidism. Several underlying conditions can lead to hyperthyroidism. The most common causes include Graves' disease. This is an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, causing it to produce excess hormones. It is the leading cause of hyperthyroidism, especially in younger adults and women. Toxic multinodular goiter. In this condition, multiple nodules or lumps form on the thyroid, each producing excessive hormones independently. Toxic adenoma. A single benign tumor in the thyroid gland produces too much hormone. Thyroiditis. Inflammation of the thyroid gland can cause hormone leakage into the bloodstream, temporarily increasing hormone levels. Excessive iodine intake. Iodine is vital for thyroid hormone production, but too much iodine, often from supplements or medications, can trigger hyperthyroidism. Overmedication. Patients taking thyroid hormone replacement therapy, for hypothyroidism, can develop hyperthyroidism if the dosage is too high. Symptoms of hyperthyroidism. The excess thyroid hormones accelerate the body's metabolism, causing various symptoms that affect many organ systems. Weight loss. Despite an increased appetite, patients often lose weight due to the high metabolic rate. Increased heart rate. Palpitations, rapid heartbeat, or arrhythmias, irregular heartbeat, are common. Nervousness and anxiety. Heightened nervous energy, irritability, and restlessness often occur. Tremors, fine shaking, usually in the hands. Heat intolerance and sweating. Increased sensitivity to heat and excessive sweating due to elevated metabolism. Fatigue and muscle weakness. Paradoxically, despite nervousness, muscle weakness and fatigue can develop. Sleep disturbances, difficulty sleeping or insomnia. Goiter. Enlargement of the thyroid gland, sometimes visible as a swelling at the base of the neck. Changes in menstrual patterns. Women may experience lighter, less frequent periods. Eye changes. In Graves' disease, specific symptoms like bulging eyes, exophthalmos, eye irritation, and vision problems may occur. Digestive issues. Increased bowel movements or diarrhea. Hair and skin changes. Hair thinning and fine, brittle hair. Skin may become warm and moist. Diagnosis. Diagnosing hyperthyroidism typically involves clinical evaluation, physical examination, and detailed symptom history. Blood tests, measurement of thyroid hormone levels, free T4, free T3, and thyroid-stimulating hormone, TSH. Typically, TSH is suppressed, low, in hyperthyroidism, while T3 and T4 are elevated. Radioactive iodine uptake test measures how much iodine the thyroid absorbs, helping differentiate causes. Thyroid scan, imaging to detect nodules or inflammation. Antibody tests, in cases suspected of Graves' disease, tests for thyroid-stimulating immunoglobulins, TSI, are done. Treatment options. Treatment of hyperthyroidism aims to reduce thyroid hormone production and alleviate symptoms. Common approaches include antithyroid medications, Drugs such as methimazole and propylthiouracil reduce hormone production by blocking thyroid hormone synthesis. These are often the first line of treatment, especially in mild to moderate cases. Beta blockers, these do not treat hyperthyroidism itself but help control symptoms like rapid heart rate, tremors, and anxiety by blocking the effects of thyroid hormones on the cardiovascular system. Radioactive iodine therapy, a common and effective treatment, especially in the United States, where radioactive iodine is administered orally. It selectively destroys overactive thyroid cells, reducing hormone production over time. Surgery, thyroidectomy, partial or total removal of the thyroid gland may be necessary in cases of large goiters, suspicion of cancer, or when other treatments fail or are contraindicated. Lifestyle adjustments, patients may need to avoid excess iodine intake and monitor symptoms carefully. Complications. If left untreated or poorly managed, hyperthyroidism can lead to severe complications. Thyroid storm, a rare, life-threatening emergency where thyroid hormone levels spike dramatically, causing high fever, rapid heart rate, delirium, and potential organ failure. Heart problems, including atrial fibrillation, congestive heart failure, and increased risk of stroke. Osteoporosis, excess thyroid hormone can accelerate bone loss. Eye problems, in Graves' disease, severe eye complications can cause vision loss. Reproductive issues, infertility or pregnancy complications may occur. Prognosis and management. With proper diagnosis and treatment, hyperthyroidism can be well controlled, and patients usually lead normal, healthy lives. Regular follow-up is essential to monitor thyroid function and adjust treatment as needed. Early detection and management reduce the risk of complications and improve quality of life. Conclusion. Hyperthyroidism is a complex endocrine disorder resulting from excess thyroid hormone production. Its broad spectrum of symptoms requires careful clinical evaluation and appropriate diagnostic testing. Treatment options vary based on the cause, severity, and patient preferences but generally include medications, radioactive iodine, or surgery. With timely intervention, the disease can be managed effectively, preventing serious complications and restoring normal metabolic balance.